This is Dr. Thomas Klein. I'm a specialist in chronic and rare painful diseases. I represent an organization that we call JATH Educational Consortium LLC. You can get to it on the web by plugging in JATHeducational.com. We will put this down below for you to remember. I'll just make a note. Today we're going to be talking about the myth palliative care does not apply to rare painful diseases. That's not true. Actually, palliative care applies to anyone who has a disease you cannot cure and you need to take care of them. Palliative care is really a simple concept and people are really having a hard time with it, which is kind of frustrating because in the first line of the CDC guidelines, it exempts palliative care and end-of-life care. So those are two different things. End-of-life care is hospice care. Palliative care is the broader concept of which hospice care is part of it. Hospice care, you have to be certified that you're nearing the end of your life within the next 60 days. Palliative care is just the opposite. It can go on for years and years. So if you want to read up on this and really the simplicity of being just old-fashioned doctoring, you can go to, you can Google medium palliative exemption Klein. And those four words will get you to this document called Palliative Care Exemption. It was written with my colleague Carolyn Concia in Portland, who is a specialist in palliative care, and we worked kind of hard on this to make it clear and interesting. It's not our opinion. This is taken from multiple sources. Whenever you hear that palliative care and end of life, then you know that they're different. And this is part of the problem with the states mandating exemptions from palliative care because they don't even know what it is. They're just kind of copying from the kid next to them. So in our little document here, we have taken and distilled down definitions from multiple sources, including the World Health Organization, which is total care of patients whose disease is not responsive to cure. This is what we've been doing for hundreds of years. Somebody has cancer, somebody has end-stage heart disease. We don't just say, sorry, we're done. No, it's our job to continue taking care of the patient, the shortness of breath with the congestive heart failure, and certainly the pain that comes with rare painful diseases. So there are basically three criteria that we've distilled, and it's really pretty simple. One, you have a disease that's incurable. Okay? There's no treatment. None of the painful diseases that we have listed under our umbrella of systemic painful disease have cures. None of them. Interstitial cystitis, CRPS, RDS, adhesive arachnoiditis, all of them. None of those have cures. So that's number one. Number two is that it may influence lifespan. Not that there's only 6 months to live like hospice. It may. The severity of these diseases can certainly be categorized as maybe shortening lifespan. Third thing is, if you treat the symptoms, you will improve the quality of life. Now, that's not that complicated. Now, who can make the diagnosis? Well, it's a medical diagnosis. Who can make medical diagnoses? Only licensed medical people. That is doctors, physician assistants, and nurse practitioners. We're the only ones that can make any diagnosis, much less the diagnosis of palliative care, which incidentally is Z51.5. It's not a billable, but it is a diagnosis code. You bill for these using pain codes, G89.2 family. You do not have to bill a diagnosis code to be paid by Medicare. All you need is a symptom code. Could be coughing, could be diarrhea, could be pain. So it's really very simple. And if you do go and Google palliative exemption, next to it will be a little certification form that we kind of dreamed up at JATH. It's just for use in your practice. In other words, a doctor will make the diagnosis in his office of palliative care Z51.5, and you could fill out this form. It's 3 pages, and you can get it on our JATH website. And it gives credence, to the diagnosis. In other words, it's a way to officially make the diagnosis of palliative care. Now, we're having problems with patients who read this and then they take it to their doctor, and we're hearing things from the doctor like, this is not for you. You have to have cancer. There's no program in our area. You have to be dying. And it's not for people with chronic pain. All of those are wrong. It is for people in chronic pain. If it's not for people in chronic pain, who is it for? It is not an official Medicare program. Only hospice is. It's a medical diagnosis. Doctors make in their office. They can fill out a form if they want, and they can bill for chronic care management codes. You need to tell your doctors they can bill extra when you're not there. And it's a great thing to do. Since it's exempted from the CDC guidelines, this protects the doctor and the patient, since high dose cutoffs are now exempted. It's the best thing we have. At JATH, we put in several comments for a lot of these federal panels, but so far nobody's made an official diagnosis mechanism. But we have one in here. It's not that tough. So next time we will be discussing a new issue, which is dependency and addiction. Someone asked that we discuss this, and that's what we're going to do. Thank you.